Heart disease and cardiovascular health have been a topic of much discussion for a long time. It is no secret that the heart is key to one's survival, so it makes it that much more important to ensure that individuals are properly educated on how to prevent heart disease, how to spot it early on, and what are the major risk factors for developing it. Through this, cases will be lowered and the overall burden placed upon the healthcare system and men will go down. As it will be further discussed later, heart disease is a very preventable affliction, making it a perfect target for mass prevention efforts. Being able to lower the death rates caused by the top killer among men would be a huge victory for public health and future generations. Over the course of this discussion, I'll talk about heart disease among men, some risk factors for heart disease, preventative measures, and how to recognize signs of heart disease. For additional information on these topics, make sure to go to the Men's Health Network website for helpful resources. Heart disease is a leading cause of death among men, beating out other prominent health issues such as prostate cancer. In 2019, 7% of men reported having heart issues. However, the actual percentage is likely much higher than this. Over the past decade, men were twice as likely as women to die from heart disease. Additionally, they were more likely to suffer a heart attack. They tend to develop CVD at a younger age, as well as having a higher risk of CHD. And the strongest factors for coronary artery disease are the male gender and age. As these facts show, men are at a high risk for heart disease and must be properly educated on the risks that come along with it. In the US, about 700,000 people die from heart disease each year, or 1 in every 5 deaths. While women tend to die from heart disease more than men, they still make up a large amount of this number and can prevent such deaths with proper education and changes. Heart disease has a wide range of causes and risk factors that can lead to adverse health outcomes among men. Some are much more common than others, but all hold their own ability to negatively impact the individual. One of the more well-known risk factors is smoking. Smoking can cause an increase in the risk of heart disease by 2 to 4 times that of someone who does not smoke. Additionally, smoking can lead to other issues that can, on their own, lead to heart disease. Smoking could be viewed as first domino in a long line of potential health risks for heart disease. In 2021, 13% of men in America smoked cigarettes, making a sizable portion of the population be at an increased risk. Other common risk factors include an unhealthy diet made up of high amounts of fat and sodium, lack of physical activity, family history, excessive alcohol consumption, stress, and obesity. The positive side of this is that many of these risk factors are preventable. An individual's lifestyle choices are often the biggest predictor of their risk of heart disease, so it's important to become familiar with these risk factors and know how to avoid them. One of the best things that can be done to help prevent heart disease is to adopt a heart healthy diet. What this entails is focusing on getting an intake of fruits, vegetables, lean protein, and healthy fats. Some examples of heart healthy foods are apples, leafy greens, oatmeal, avocados, beans, fatty fish, and tofu. Limiting intake of salts, saturated fats, and junk food are also important. Another way to help prevent heart disease is to engage in regular exercise. Going for a run, lifting weights, yoga, walking, Pilates, and engaging in recreational sports activities are all fun ways of making sure that you stay active and fit. Different age groups have different activity levels that they should aim for. In general, most adults should aim for 150 minutes of moderate aerobic activity a week, or 75 minutes of vigorous aerobic activity a week. Additionally, the individual should engage all major muscle groups in strength training at least 2 times a week. Other preventive measures include monitoring blood pressure and cholesterol levels. These can be a telltale signs of heart problems and can help to alert you to issues before they become serious. As I have discussed so far, there are many different causes of heart disease, so it makes sense that there are also many different warning signs that it is developing. One of the more common signs is chest pain or discomfort. This would feel like pressure, squeezing, or a burning sensation in the heart. These symptoms are close to that of heartburn, so it's important to remember that just because you may be feeling pain in your chest does not mean that you have heart disease. However, it is a sign that you should take note of it and bring it up to a healthcare professional if it is recurrent or persistent. Other symptoms can be shortness of breath, irregular heartbeat, fatigue, lightheadedness, and swelling. High blood pressure, also known as hypertension, can also be a sign of heart disease. While it can also be a risk factor, some individuals may notice their elevated blood pressure levels and seek a test that leads to a heart disease diagnosis. If any of these signs are detected to an unusual level or in a way that causes discomfort or concern, it is extremely important to seek medical attention as soon as possible and determine whether or not you have or are at an elevated risk for heart disease.